Well, this morning we are learning the true number of Hoosiers with coronavirus could be much higher than numbers actually show.
Here's what we're seeing right now. More than 24,000 Hoosiers have tested positive. Some 1,400 have died. In all, more than 146,000 Hoosiers have been tested. But now we're learning just because a test comes back negative doesn't necessarily mean you're free of COVID-19. Matt's live to talk about the accuracy of testing. Hey, Matt.
Yeah, good morning to you. Of course, getting life back to normal, which will include rush hour traffic. There's really no traffic here at the 65-70 split, but a big part of getting all of life back to normal is expanded testing, says the governor. And as you can imagine, there have been dozens of clinics that have been popping up all across the state. Well, new this morning, 13 Investigates is now learning about a potential issue when it comes to testing accuracy. The state health commissioner says even if a test comes back negative, that doesn't mean you're free of COVID-19, meaning that you might have had the virus. In fact, we're learning this morning that happens about 30% of the time. Health officials say it's most common in people who are asymptomatic. So even if you've tested negative, keep an eye out for possible symptoms. Another way Indiana is trying to track and slow the spread of the virus is through contact tracing, and a big effort of that just launched tomorrow. It basically keeps tabs on people who had a positive person and who they may have been around. Of course, later this afternoon, we'll get the COVID-19 numbers here for the state, all as testing continues to expand. Ben and Julia.
All right, Matt, thank you very much. Here at 504, Indiana is working on what happens after someone tests positive for COVID-19. The state just launched a centralized contact tracing center, and here's how it works. Contact tracers identify someone who's tested positive. That person then goes into isolation. Then the contact tracers track down anyone that came in close contact with that person. Those people then get tested and quarantine. It's a system that's been used for decades for diseases like measles or TB, but state leaders say there are some differences now.
Big difference here is that this is on a much wider scale during the middle of a pandemic.
Indiana's already hired 325 contact tracers for their call center. The goal is to have 500 by the end of the month.
The White House is recommending all nursing home residents and staff be tested for coronavirus in the next few weeks. Now, the story has a lot of people talking online, and Meredith joins us now to share your comments. Good morning, Meredith.
Hey, good morning, Ben and Julia. Yeah, exactly that. So the goal now is to get all nursing home residents and staff tested for COVID-19. And a lot of you guys had stuff to say about this on Facebook. But to give you just a little bit more context, Vice President Mike Pence announced this on a call with the governors yesterday, saying that the federal government strongly recommends that such testing be done. Dr. Birx saying that the focus over the next 2 weeks is going to be to test all 1 million nursing home residents. So here's what you guys had to say on Facebook. Joanne saying, I don't see the purpose unless we're testing the caregivers as well every single day. They go out, they come back in. That's how this kind of stuff spreads. Anita saying, I can't believe all these states and governors haven't done this yet. Why did they have to wait to be told to do so? And Jean saying, this should have been done a long time ago, but there simply are not enough tests. No matter what they tell you, these tests are in short demand. What do you think about all of this? You can tweet at us using the hashtag 13sunrise. This is also part of our poll question for the day. You can go to WTHR.com/vote, or you can connect with us on Facebook. There are so many ways to join in on the conversation. We monitor them throughout the show. We want to hear your thoughts, guys.
All right, Meredith, thank you. And remember, this morning we do want to know if you're worried about safety in long-term care facilities. So far, most of you say yes. So tell us yes, no, or maybe you're not anymore. You can vote on the WTHR News app or at WTHR.com/vote.
And here are three of the coronavirus stories we'll be watching today, starting in Carmel, where the fire department's setting up an information booth at the Meijer store on Carmel Drive. Firefighters will hand out free hand sanitizer and COVID-19 information from 9 this morning until 1 this afternoon. Hey, the Blue Angels will have a flyover here in Indy today to salute people on the front lines of the coronavirus pandemic. The Blue Angels are set to start in Beech Grove around 2 this afternoon and will make their way to downtown Indy for about 11 minutes. And finally, Dr. Anthony Fauci is set to testify in front of a Senate committee today. The Health, Education, Labor, and Pensions Committee will be talking about how to get Americans back to work safely. Dr. Fauci is following a modified self-quarantine, but is still expected to testify. The hearing starts at 10. this morning. And for those of you headed out to work,